We are going to talk about the assessment and nursing process as it relates to the hematologic system. In terms of assessment, vital signs are always important when evaluating the hematologic system. Body temperature you usually think of as a fever being present in infection, but that's not always reliable if someone is immunosuppressed or if you are looking at an older adult. You can have a subnormal temperature if you have an overwhelming gram-negative infection, and so you have to be very careful in evaluating body temperature. You can have an elevated heart rate and respiratory rate in anemia, with blood loss, and also with hypoxemia. And of course, you get hypoxemia sometimes when you are anemic and you don't have enough red blood cells to carry the oxygen around, or with blood loss when you don't have enough red blood cells to carry the oxygen around. If you look at the head and neck, the color of the conjunctiva and the sclera of the eye can be very telling in terms of the hematologic system. For instance, jaundice can show up in the sclera and the conjunctiva, and that can be very useful when you're evaluating dark-skinned people. Same with pallor and anemia in the conjunctiva, as you can see here. Also useful when you're evaluating people with darker skin. The condition of the gums and the oral mucous membranes are important here. They can be bleeding if you have a problem with clotting. They can be pale if you are anemic. You can also look at the tongue. You get a very beefy red appearing tongue in different kinds of anemia. And then also, of course, there are enlarged cervical lymph nodes. Now, there are painful nodes that are enlarged, usually in the presence of an infection, and non-painful nodes that are enlarged that are possibly enlarged in the presence of a malignancy. Continuing on to the assessment of skin, you think of pallor in terms of anemia, but not just the skin. You can look at, as I mentioned in the previous slide, conjunctiva, the palms of the hands, and the roof of the mouth is also in the previous slide in people with dark skin. The condition of someone's fingernails. You can have very brittle, spoon-shaped nails in certain kinds of anemia. The presence of ecchymosis or petechiae. So petechiae are the little bitty red dots. They can be macular or papular, which means they can be flat or raised. And ecchymosis is a bruise, and this can be present if you have a problem with clotting. Jaundice is something that you can see as a yellow cast to the skin, also can see in the sclera on the conjunctiva, as I mentioned earlier. Nasal or gingival bleeding can be apparent if someone has a problem with clotting, and also your hair becomes dry, brittle, and thin in the presence of anemia. Moving down to the chest and the abdomen, the presence of swollen lymph nodes in the armpits or the groin, especially non-tender ones, can be a clue for you. Rapid respirations and shortness of breath on exertion can happen, especially with anemia, and as can a rapid heart rate at rest. A widened pulse pressure, greater difference between a systolic and a diastolic pressure, can be a clue when you're dealing with the hematologic system. Epigastric tenderness and abdominal distension can also be assessment clues. If you look at the extremities, the presence of swollen or painful joints, as in hemarthrosis, which is what we see in these knee joints, or in this knee joint here, that can be present in hemophilia or in sickle cell anemia. If you look at their fingers and toes, different lengths of fingers and toes can be from hemarthrosis, again in either sickle cell or hemophilia. Looking at urine and stool. In urine, the sign of blood can often be apparent. In the stool, it can be occult or hidden, which is what we test for when we do fecal occult blood test, or if we guaiac their stool. Mental status can be an issue, particularly in older adults with anemia. You can become confused if you are, and that's a later sign of anemia. And also activity intolerance. This is a sign of hypoxemia, as is actually the altered mental status, and can occur with anemia. We always want to consider the normal age-related changes with any body system and how those changes affect a particular disease state in that body system as well. So if you look at the blood volume, it is decreased as we age. And so if you have a decrease in your reserve blood supply, it's hard to recover from blood loss, from any kind of hypovolemia, and can often lead to shock more quickly. Your bone marrow activity is decreased, and so your cells are produced at a slower rate, again, making it hard to recover from a blood loss or a hemolytic event. You have decreased production of new red cells and decreased production of vitamin B12, so decreased intrinsic factor, and this can lead to anemia in older adults. You have less white blood cells and a decreased antibody response because of it, so therefore your immune response is decreased as you age. Therefore, you become more susceptible to infections, and your ability to fight infections is decreased. Also, your ability to mount an immune response to a vaccine can be decreased, and that's why there are the higher potency flu vaccines for older adults. Your platelets aggregation activity is increased as an older adult, and so therefore they're more prone to aggregate, which means you are more prone to clotting. And then also you can have possible nutritional issues. Note I said possible, it's not always an issue, but sometimes if people have poor dentition or dentures, they don't eat as much meat, and that may decrease their iron intake. They may be on a limited or fixed income, may have transportation issues. Think of the social determinants of health here. So they may not be able to get out to shop. There may be social factors here in terms of their nutrition. They don't want to eat alone. They don't want to cook just for them. They don't have the ability to get out and maybe go to the senior center, see friends or family. So all sorts of nutritional issues can be possible in older adults. Considering the possible nursing diagnoses for the hematologic system, it really depends on what particular part of the hematologic system you're having a problem with, whether it's red cells, white cells, or platelets. So risk for infection, obviously the white cells. Risk for bleeding, obviously the platelets. Activity intolerance, more the red cells. Altered nutrition, that could really be for anything, but if your nutrition is altered, a lot of times that can be a cause for anemia. Risk for injury, especially with decrease in clotting activity, clotting factors, or in platelet activity, can also be a problem with a decrease in white cells because your immune function is decreased. Impaired skin integrity can be a real issue, especially if you have a risk for infection or a risk for bleeding from a decrease in white cells or platelets. And finally, pain. Pain can be huge if you have a bone marrow problem, very, very painful bones you get with a lot of different kinds of bone marrow diseases, and also the hemarthrosis that happens when you bleed into a joint. That is also very painful. Nursing goals will follow from the nursing diagnoses that you've made. So preventing infection, conserving energy, correcting nutritional deficiencies, treatment that the provider will initiate. It's your responsibility to carry it out, and then also controlling the pain. Some things to think about when giving nursing care to people who have problems with their hematologic system. People with blood dyscrasias need to be handled very gently to prevent bruising and hematomas. They can bleed into their skin very easily. If you are doing anything that breaks the skin, an injection or a venipuncture, or doing any kind of wound dressing that may provoke bleeding, you'll want to think about pressure. Applying pressure for 5 to 10 minutes after injections or venipunctures to ensure that a clot is formed. Good skin care is essential here. Skin acts as a protective barrier against infection, and if you think about older adults, they have very thin skin and fragile vessels, and so maintaining that skin is very, very important in people with problems with both clotting and their white blood cells. People with blood disorders are at higher risk for infection, and so teaching becomes important. Teaching infection prevention and control to your patients and their families, and then also for the nurses to use scrupulous aseptic technique when taking care of these people. Quite often they're isolated in protective isolation depending on what phase of their disease process or treatment they're in, and so prevention of infection is important in maintaining isolation, not just with the healthcare providers, but also with their family and friends who come to visit them. Other education ideas are to teach about nutrition. This applies to everyone with a hematologic disorder, but is particularly important in people with iron deficiency anemia. Medication administration, these people have many different specialized medications that they take to restore their blood cells to their normal function. Some of them are oral, some of them are injections, and different techniques need to be used for them to take their medications, because they'll be doing it themselves. They won't be in the hospital forever. Prevention of infection, again, really important, especially people with problems with the white blood cells, and then measures to prevent bleeding in people who have clotting disorders. Pain control, as I've mentioned before, very important for people with sickle cell anemia, because their sickle cell crises are very painful. People with hemophilia and hemarthrosis, very painful swollen joints, and in people with advanced leukemia, multiple myeloma, they have a lot of bone pain, and bone pain can be extremely Evaluation of the treatment that you are giving for the person's hematologic problems. Often serial blood counts or serial blood draws for a CBC and differential will be done to determine whether or not the medications are working or whether the disease process is getting worse. You'll also want to assess for side effects and evaluate how the patient's tolerating the medications they're being given or other treatments for the underlying disorders. Sometimes this will be labs, sometimes this will be So look at the changes in their presenting assessment data. If they present with fatigue, shortness of breath, is that better? Is their activity tolerance better? Are they doing, able to do more? Look at how they're following the prescribed treatment plan. Are they able to eat more nutritionally? Are they able to get food? Are they cooking for themselves? Are they going out to the senior center, getting Meals on Wheels, whatever it takes to meet those nutritional goals? Evaluate all aspects of the treatment plan, and then if it's not working, of course, you're going to want to consult the provider about changing maybe some medical aspects of the treatment plan, or look at your nursing care and maybe change up some of the interventions. There are a couple of very special situations that I want to talk about regarding evaluation. One is when a patient is undergoing chemotherapy. You really want to keep a close eye on those blood counts to determine that you have safe levels of leukocytes and platelets before you give another dose of the drug that inhibits their production. And so if those counts are really low and you're scheduled to give more chemo, that's a phone call to say, is this what you really want to do? Another reason to look at the blood counts is before giving colony stimulating factors, because you want to know if the counts are rising and are they to the point where you don't need those colony stimulating factors anymore. So those are important safety considerations before giving certain medications. Finally, let's talk about some common problems related to people who have hematologic disorders. One that we've talked about frequently is excessive bleeding. So interventions for this include applying pressure, and there are diagrams in your book for pressure points to use. Position with the bleeding body part over a firm surface and use a sterile dressing or a clean cloth, whatever it is you have, and apply direct, firm pressure for 5 minutes. Check after 5 minutes and then use pressure for another 10. Do not remove the original dressing. Always reinforce the dressings. You don't want to disturb any clots that might be forming. You also want to check the circulation distal to that pressure dressing and make sure that you're getting adequate circulation. Pressure on the artery is the last resort if the bleeding won't stop, because if you put pressure on that artery, then you are disturbing the blood flow to the surrounding tissues. Think about people who have problems with fatigue, and this is a really big deal for people with anemia. This affects all parts of the person's life. So you want to help them learn to space their activities out with frequent rest periods. Space out your nursing care, cluster your care, and give them time to rest in between. Reassure them that the stamina will come back when their blood counts rise again, and also work with the patient and the family to decrease the workload and the expectations that are on them, either in the workplace if they are still working, or in the family. Try to get them some help around the house, try to get some other family members or friends to pitch in, anything that will allow them to rest and heal during the time that their body is producing more cells. Anorexia can be a problem, not necessarily because of issues with the hematologic system, but more often with their treatment. And so you want to look at frequent small meals, meals that are high in protein, because it takes a lot of protein to rebuild these cells. Foods that are high in vitamin C and iron, again, necessary for producing these cells. Mouth care before and after meals. Chemo can really leave a bad taste in your mouth. Appealing foods, foods that look good, foods that they like. Make sure you're giving them stuff they like. Get rid of the smells in the environment. Make sure they're eating in a pleasant environment. And ask family to come and hang with them during mealtime. So providing socialization is so important. And if people are older, if they're home, if they're shut in, that is really a big deal. So anything that can be done either to get people in to visit or to get people out of the house to have a meal with friends or family can really help with this. Pain control, again, very important in people who are bleeding in their joints or who have severe bone marrow disease. So you want to assess and medicate every 2 to 4 hours depending on what you've got ordered, and teach non-pharmacologic methods of pain control so that they can have a little bit of control over the pain on their own. Infection, of course, is a problem. This is not only scrupulous nursing care, but also teaching the patients and the families about prevention, protection. Sleep and nutrition are really important for infection control, and I don't think people always understand that. And so including that here is a big deal. And then also when they have bone marrow failure, they'll be having bone marrow transplants or a stem cell transplant. And this nursing care is a level unto itself, and your book talks about that, and we will talk about that in another lecture.